Continuing coverage now of the crash of Flight 214. 5 airline passengers are in critical condition at San Francisco's General Hospital out of 34 total who were transported there. San Francisco General got 3 waves of patients whose conditions range from critical to good. The trauma center set up tents outside the emergency room to help deal with the crush of patients. And a spokeswoman says a spontaneous wave of off-duty staffers showed up to help. Doctors, nurses, and social workers. I want to bring in here in New York, Dr. Devi is with me. So help us to understand the types of injuries that these patients could have sustained.
Well, we don't have enough information to talk about the specific injuries, but there are general patterns of injuries that we would be worried about. So whenever there's an explosion, as in this case where there was a fireball, there are 4 general patterns of injuries that happen. So the first is related to the blast wave itself. And the blast wave can affect the soft organs, so the brain, the lungs, the intestines. The second type of injury is related to materials being propelled. So what you worry about is glass or fragments and things injuring people directly. Now, the third type of injury is related to people being propelled against something, like a wall. In this case, there shouldn't be too many propulsion injuries because people should have been wearing their seatbelts. So the risk of that is a little bit lower, especially during landing. And then the fourth type of injury is related to burns or people with medical conditions then having medical emergencies.
But to hit the ground hard enough for the rear of the plane, the rudder to break off, the tail section of the plane, that's a pretty big jolt.
It's a huge jolt, actually. And it's enough, even with the fourth type of injury, you can have people who have heart disease, for example, having heart attacks, asthmatics having asthma attacks. So there are a lot of different categories of injuries that can happen, for sure. And the crush injuries actually would be in that category. Now, we don't know what types of injuries people have at this point, but those are the 4 general categories that you would look at.
Yeah. Originally, they said it was a crash landing, which it is, and they said it's a hard landing. But, you know, the neither here nor there with that. But my question is, despite the trauma, there's got to be emotional trauma as well when it comes to this.
Of course. So right now, people may be in shock, and we may not see a lot of the toll from the emotional trauma. We may be just seeing the beginning of it. But over the course of the next few days to weeks or months even, we may see people with more signs of PTSD, post-traumatic stress disorder, or even people who have brain injuries. Now, the things that you worry about are mild brain injuries as well. Right now, they have enough information to find people who have severe brain injuries or spinal cord injuries, but the milder ones take some time to develop. So what you worry about there, it's kind of like having a rubber band. It just basically stretches out and then kind of comes back together, so it could look okay. So you might not see a mild brain injury on a CT scan, for example, because it will still look normal. But later, let's say with the rubber band, it doesn't work the same way anymore. So in the same analogy, if you have a mild brain injury, some of those neurons will not work the same way that they had before the blast.
So for some people, the worst may yet be to come.
Yes, it might be.
Yeah. Dr. Devi, thank you. Appreciate you as well. We're expecting another update from San Francisco General Hospital in just a few minutes. We'll be right back.